Have you ever wondered why you have abnormal vaginal discharges? Do you have pains during sexual intercourse? Do you bleed heavier than your usual menstrual cycle or your menstrual period? We are looking at cervical cancer, and the second most leading cause of death in women across the world. So today we are looking at cervical cancer on Health Talk with TV. My name is Adra Duma Ansa, and once again I have with me Mr.
Steven answer.
So today we are discussing cervical cancer, which is very, very important when it comes to women. So you want to know more about cervical cancer, its causes, risk factors, and if there is treatment.
Okay.
Okay, so can you please tell us what cervical cancer is about, or what is it?
Okay, thank you very much for this question. And today I would like to recommend, or I would like to say you are doing a very good job by saying it is the second most leading cause of death in women.
Thank you
Yes,
very
so
much.
women out there, you should take it very serious. Now, when we say cervical cancer, it is, you see, the vagina is there. We have the cervix, which is also part of the
Reproductive
reproductive
system.
system. So when there is a conscious tumor or there's a conscious tissue in that cervix, that's what we determine as cervical cancer. So it's a malignant tumor, which means it can spread, not just only the cervix, but it can go apart.
Okay, so the malignant, as you mentioned, also simply means that when it starts from, if it starts from the cervix, it means that as time goes on, if not detected earlier, it can get to maybe the bladder, can get to other organs, which can spread
yes.
to.
That's one thing about cancer. When cancer is there, if cancer is there and you don't treat it, it will rather cause more trouble for you. So before you detect it and fight it, then you are fighting another thing else. That's why we have days for this disease for people to go and check and know. So it's very important for women out there to go and check.
Okay, we want to know what are some of the causes of cervical cancer.
Oh, okay. So what I can say is that the virus called papilloma virus or human papilloma virus, which is the HPV, or people with HIV too can contract this cancer.
Okay, so human papilloma virus, which can be transferred sexually to people. So when you are sexually active, or you have multiple sexual partners, it can also cause you to have cervical cancer as a result of human papilloma virus. So we want to know some of the warning signs. If I am here, what can I tell, or what will show, or what will happen to my body to prove that this is a sign of cervical cancer, so I should seek medical attention?
Oh, okay. So you see, for the ladies, when you're having sex, you see, after sex, you start bleeding. You get it, and you see, menstrual bleeding is different from cervical bleeding. You get it. Someone might think that it's menstrual bleeding, but it's cervical bleeding. So which is after sex, you start bleeding.
Okay.
You get it. You think that it's because of the sex, but no, it's the cancer that's causing that to happen. You understand?
Okay. Okay. So it means that when I have bleeding, or when I bleed after sex, there could be a sign that I'm having a cervical cancer.
Yes.
And also painful during sexual intercourse can also, when you have abnormal vaginal discharge, can also be a sign that you have a cervical cancer. When you have abnormal vaginal discharge, it can also be as a cause of, or abdominal pains, unusual ones. It can also be a sign of cervical cancer. So we look at risk factors. What are the factors that can make me get cervical cancer?
Okay, so the primary or the most important cause is the having unprotected sex
Okay.
can cause that, and then also people with HIV, they are likely to be exposed to this cancer.
So concerning people with HIV, it's mostly, aside HIV, people with immunocompromised disease like tuberculosis, those chronic disease that
diseases
will
can also
make your
affect
immunity low can also put you at risk.
risk.
And also, if you smoke, if you're a woman and you smoke, you can put yourself at risk of having cervical cancer someday. And if you've had a full-term pregnancy, like your first baby, second baby, you had a full-term pregnancy, can also put you at risk of having cervical cancer. Then it could be as a result of family history or genetic factor. Someone in your family someday was diagnosed with cervical cancer. You can also be at risk of having cervical cancer one day. Then I want to know, how long can you have cervical cancer without knowing? How long can I have a cervical cancer without knowing?
You see, cancer doesn't really have a particular time, but they have symptoms. So when you begin to see these symptoms, I believe you should rush to the hospital and check yourself. Even some might even and cancer too can alert you or give you the symptoms in maybe 6 months, maybe 1 year, or see this it doesn't show early as possible. Maybe 6 months upwards you can get this.
So before we go to how long we can have, I would like to add that females or women who take oral contraceptive as a birth control pill are also at risk. So if you are taking the birth control, you should know how you take it. Not taking it every month or just every 3 months, or when as and when you have unprotected sex, you take it. So you should know how you take all those. Then when you have chlamydia, or you've ever had chlamydia before, you can also put yourself. And with the how long you can have a not knowing, you can only know when you have cervical cancer when it is at the advanced stage.
Yes, that's why I said when it starts giving you this symptoms, you have to know that.
So most of the time, primarily, you don't see the symptoms of the cervical cancer.
You don't see.
When it gets to the advanced stage, then you start to know the symptoms. So if I have cervical cancer, how can I be diagnosed of cervical cancer?
Yeah, so we have pap smear. We have a test we call pap smear.
Okay.
So where they take a swab of the vagina, then they put it in where we culture we culture the smear, and we know what actually is wrong with you and how your tissues have been affected.
Whether they are being overgrowth and it can also have imaging. You can do imaging to also know.
Sure.
Now, if my cancer or my cervical cancer is left untreated, what happens to me? If my cervical cancer is left untreated.
Okay, I would like to make this point that every disease which is left untreated can cause other diseases. So which means, since we said it's a malignant tumor, it means it can spread. So it will spread across the reproductive system, which we already know can even lead to maybe death or loss of blood, this kind of stuff.
Okay, so can it be treated or cured?
Yes, but when at the early stage.
Okay.
At the early stage.
It can be.
Yes, it can be at the early stage. But when you don't see it and it has spread, then I think we can't do anything about it. We just have to cut off the whole private part.
Okay.
Yes.
So it is very true. At the early stage, most of the times, all diseases are being able to manage or treated very well when they are at their early stages. So the earlier the better. One has to have a regular checkup with their
Yes. Yes.
gynecologist to know what is going on down there. If there is,
You see, sometimes it's human nature. We feel that since I have not seen the symptoms, then I'm not
I
suffering
don't
from
have,
that. You might even be at the primary stage,
but you
so
wouldn't
but
know.
you don't know. But when you go there and they say it, then they can be able to work on it.
Then I want to add this. Every woman or every lady at a point in her life would have the HPV virus. But just that those with a strong immunity will fight
Fight
the
again.
virus. But those with the immune compromise, that is when the virus has to start causing
Yes,
a effect or
that's very
cancer
true.
within them. Please advise our listeners or our viewers today on what they should do, especially to our women out there.
Okay, to my lovely women, because man, I'm afraid my do so. To my lovely women out there, I would like to start in when you are taking a partner, know your partner, because these are cancer that can be transferred from one person to the other. So it means that you have to have protective sex. If you don't know your partner very well, you have to have a protective sex. And also, don't wait for you to see a sign before checking this cervical cancer. Maybe 1 month you go to the hospital, 2 months you check yourself out. And if there is anything, the clinician or the doctor can recommend something for you that will remove this cancer from you.
All right, so know your partner very well. Make sure you have one partner. There's no need having multiple partners. That is putting you at risk of having HPV and cervical cancer one day. So you have to know your partner, have a protected sex, and know yourself. Know that this is a normal period I'm having. This is abnormal. I'm bleeding heavier than I used to, and know that this abdominal pain I'm having is not just menstrual cramps, it is something else. So we have to know ourselves and have a regular checkup to check to our gynecologist in order to see if there is possible cervical cancer or HPV virus, which can put us at risk of having cervical cancer one day. So make sure you do all these things and we all stay healthy. Thank you so much for staying with us on today's episode on cervical cancer on Health Talk with Fifi. We'll be back with another topic next week. Stay blessed.